everybody has a copy of this?
Yes.
Okay, good. Let's get started. Ventilation. We all agree what is ventilation. Can you tell me what ventilation is? Air is coming in, moving in, and
Moving out.
move it out. What's coming in is rich in oxygen, and what's coming out is rich in what?
Carbon dioxide.
Carbon dioxide.
All right, good. Certain things that you're supposed to be familiar with when we're talking about ventilation or when we're talking about the movement of air. It just doesn't happen like that. There's certain things that happen, but let's talk about terms first. Can anybody explain to me what barometric pressure is? Atmospheric pressure. It's the pressure that surrounds us, right? Under normal circumstances, this pressure is equal to what?
760 millimeters of mercury.
Millimeter
Of mercury.
of mercury, right? Okay. This pressure is very important when we start talking about the pressure inside the lungs. Okay? So we need to know this pressure. However, I need you to know as well that when I start talking about pressure, I will give this a baseline of 0, which means if I say the pressure at the mouth is 0, it means it's equal to what?
760.
If I tell you the pressure inside the lung is 2, it means how much? 762.
Okay.
Got it?
Oh,
Do you understand?
yes.
Yeah.
If I tell you it's -3, which is, I should put the units. If I tell you it's -3, then it's going to be what?
757.
That's it. Okay. So we're good and that everybody understands that.
Mm-hmm.
Okay. Another thing that I want you to understand, if there's a tube and air is flowed from this direction to this direction, I want you to know that it'll go from low concentration to high concentration. So if I have a pressure gradient of 5 in here, this should supposed to be higher than 5. Right? Okay, so this is supposed to be 10, let's say, 11, 12, 13, whatever. But it's going to be higher for air to flow from this direction to that direction. So I'm creating what? Pressure what? Gradient.
Gradient.
If I don't have a pressure gradient, then I can't have a flow. Flow is 0. Yes?
You say high to low?
I thought it was low to, I mean, it's high to low, not low to high.
High to low. You're right. You're absolutely right. From 10 to 5. So it's going to go from high pressure to low pressure, right?
Right.
Do we all agree on that? If there is no pressure, if there is no flow, then the pressure is what? The same in each one of them, correct?
Yes.
Do you agree on that?
Yes.
Anybody has a question?
You're just saying, you just flipped it on us, that it goes from 10
Yes,
to 5.
because
Okay,
it's gonna
just
go,
so,
think about it. It's going to go from whatever
yeah,
is high
high
to
to
whatever
low.
is low.
Okay,
My bad, sorry.
that's okay. I was signing and I wasn't paying
Got it?
attention. Yes.
I need to go over that again. Do you understand this concept? Because this is very important. If you don't understand it, raise your hand and tell me I don't understand, go over it again. Kyle, do you understand?
Yes, ma'am, I do.
Why do you look puzzled?
I mean, if you're making fun of me, that's cool. No, I mean, laughter at my expense is always a good thing. No,
It's
You understand? Good.
silly. Oh my god.
All right. So, let's talk about Boyle's law.
Okay.
Boyle's law is somebody that came along and explained the thought and said, if I have a container and this container contains gas, okay? Right?
Mm-hmm.
And I come along and I do what? And I compress this gas, and it's supposed to be the same container now. What's going to happen to the pressure in here?
It's going to increase.
Increase.
Right? It's going to increase. So what did I do to the size of the container?
It's small.
Decrease the volume.
Increase the volume within the container.
That's right.
If you pushed it down, you decrease the volume.
What did I do to the size of this container? Specific question.
Change the volume.
I decreased it, right? The size, look at this. This is the container right here, and this is where the gas is. I compress the gas, I decrease the volume, right?
Yes.
Do you agree?
Yeah.
Yes.
What did I do to the pressure when I compressed it?
You increase
Increase
the
I
it.
increase
pressure.
the pressure. So they're inversely proportional.
Proportional.
If I increase, let's put it this way. If I decrease the volume, I increase the pressure, right? Okay. Let's relate this to our lungs. When we breathe in, we inhale, right? The diaphragm does what?
Goes down.
Contracts and goes down, right? What's happening to the thoracic volume? Increase,
Increases.
expands, right? So what's going to happen to the pressure now?
Decrease.
Do you all agree on that?
Yes.
Mhm.
Yes?
Yes.
Okay. Vice versa. If I exhale now, what's happening to the volume of the thoracic cage?
It's decreasing.
Decrease.
It's pulling up, and the diaphragm goes up, right? Pulls up. And then it's decreasing. So the pressure is doing what?
Increasing.
Increasing.
Increase.
Do we understand this concept?
Yes.
Okay. Somebody reads. Come on, volunteer, come on.
Read what?
Where do you want to
Where
start?
do you want us to start?
This.
At the top?
Yeah. Let's start from the beginning.
Okay. Ventilation. It is the process of moving gases between the external environment and the alveoli.
Do we agree on that?
Yes.
Okay. Let's keep going.
Barometric pressure or atmospheric pressure. It is the force exerted by that air that surrounds the earth and the body. At sea level, under standard condition, the atmospheric pressure is 760 millimeters mercury, and
Millimeter of mercury.
or barometric equals, the barometric pressure equals 760 millimeters.
And that's how you write it, basically.
Okay.
Now, when we're talking about pressure in the lungs, this gets a value of what? 0, right? Just for simplicity now, okay? Let's keep going. Somebody else.
When talking about ventilation pressure, it is important to understand that the atmospheric pressure is given a baseline value of 0.
Okay, keep going.
For example, when saying that the pressure in the trachea is -5 millimeters of mercury, it means that the trachea is lower than the barometric, is that what I mean?
Barometric pressure. That's okay.
Barometric pressure by 5 millimeters of mercury. Also, it is important to understand that in order for gas to flow from one point to another, there must be a pressure difference or a pressure gradient.
Do we understand this?
Yes.
Somebody else.
Boyle's law states that the volume of gas is inversely related to the pressure of the gas in a closed system at a constant temperature. What this means is that as the pressure increases, the volume will decrease, or as the pressure decreases, the volume will increase.
Okay? Next. Somebody else.
When stimulated to contract, the diaphragm moves downward, airflow down to alveoli since the barometric pressure is greater than the pleural and the alveolar
Stop right there.
pressure.
Stop right there. When it's stimulated to contract, right? So the thoracic cage is getting bigger, right? And air is gonna flow. Now, do you think the pressure in the alveoli it's gonna be lower or higher than the atmospheric pressure?
I think it's lower.
Now think about it. I told you there was a tube, and in order for gas to flow, you're gonna have what? Pressure gradient. So we know it's not gonna be the same, right? Now the air is flowing from the mouth down to where?
Lungs.
But so it's gonna flow from a higher mouth pressure to a lower pressure. Do we agree on that?
Yes.
So it's gonna the pressure in the alveoli, is it gonna be lower or higher?
Lower.
Lower. And then as it increases, what's gonna happen?
Yeah, the pressure increases.
And then it's gonna come to a point where what? There is no gas flow anymore. And that what ends your inspiration. Does that make sense? Let's keep going.
The chest cavity enlarges, therefore the thoracic volume increases. As the thoracic volume increases, gas moves from the atmosphere down the tracheobronchial tree across the pressure gradient until the two pressures are in equilibrium. This point is known as end inspiration.
No more gas flow because the alveolar pressure is equal to what now? Mouth pressure, and we have equilibrium now. Keep going.
During expiration, the diaphragm relaxes and moves upward. The size of the thoracic cavity decreases, and intrapleural and intraalveolar pressures increase. Intraalveolar pressure is greater than the barometric pressure, allowing gas to move out of the lungs across this pressure gradient until the intraalveolar pressure and the barometric pressure...
Stop right there. So the diaphragm contracts. What's going to happen to the pressure? Increases because the volume is decreasing now, right? So it's going to do what?
It's going to force the gas out.
The alveolar pressure is going to be higher than the atmospheric pressure, forcing the air out. Right? So it's exactly the reverse of what we did on inspiration.
Finish? Finish.
Yes, go ahead.
Once again, an equilibrium known as end expiration.
So when there's no more flow, we're again at equilibrium. Okay? For some reason, students have hard time understanding this concept. Do you guys understand?
Yeah.
Yes. Okay. Somebody. Come on. I'll start calling names.
Gas will always travel from an area of higher pressure to an area of lower pressure. All pressures are expressed in millimeters of mercury.
Keep going.
In order to understand the pressure characteristics of the lungs, you need to know the following 4 definitions and formulas. Driving pressure, the pressure difference between 2 points in a tube or vessel, and thus the force moving gas or fluid through a tube or vessel.
So if I have a pressure of 15 and of 5 and a pressure of 15, how is gas gonna move?
It's going to move from 15 to 5.
It's gonna move this way, right?
Right.
And the pressure gradient is how much?
10.
10. Because it's 15 minus 5.
5.
That's the pressure gradient. If this is pressure 1 and this is pressure 2, it's going to be 15 minus 5, and it's going to be what? 10. Do you understand?
Mm-hmm.
Okay, keep going.
Calculation, driving pressure equals P1 minus P2. Example, if P1 equals 20 millimeters of mercury and P2 equals 5 millimeters of mercury, then 20 millimeters of mercury minus 5 millimeters of mercury equals 15 millimeters.
Which is your driving pressure, and that's exactly what I explained in here. Next, alveolar pressure. Somebody else.
How is the pressure within the alveoli? Alveolar pressure determines whether air will flow into or out of the lungs.
And that would make sense, because if I don't have pressure gradient, if the pressure in the alveoli was not higher on expiration, gas is not going to flow out. Right? Okay, keep going.
When alveolar pressure is decreased, as is the case during inspiration, air flows from the higher pressure at the mouth down the lungs into the lower pressure in the alveoli. When alveolar pressure is increased, during the case of expiration, air flows out. At end inspiration or end expiration, when flow temporarily stops, the alveolar pressure is 0, the same as the atmospheric pressure.
So alveolar pressure is the pressure within what? The alveoli. That's why it's called alveolar pressure. And in order for on expiration, in order for gas to flow out, it's supposed to be positive or greater than the atmospheric pressure. In order for gas to flow in, it's supposed to be below atmospheric pressure. And if atmospheric pressure gets a value of 0, then it is negative on inspiration and positive on expiration. Does that make sense?
Mm-hmm.
Question? No.
Yeah, I was just.
Okay. Pleural pressure.
PPO is the pressure in the pleural space between the visceral and parietal pleura. During quiet breathing, the pleural pressure is negative. That is, it is below atmospheric pressure.
Okay. This pressure is always negative on inspiration and on expiration. Pleural pressure. What is the pleural space? Somebody.
The space between visceral
And it's supposed to have what?
fluid.
Fluid.
That does what?
Lubricates it.
And makes these two, it
Keeps it
creates
together.
enough surface tension to
Yeah.
to have the lung and the thorax attached to each other.
Yes.
So when the lung expands, the thorax doesn't go on its way and the lung doesn't go in
Stay
the other
together.
way.
Yeah.
Because the thorax tends to what?
Expand.
Outward, and the lung tends to what?
Okay.
Go inward,
Mhm.
right? So because of these two holding the lung and the thorax together, it actually makes it kind of like it opposes the forces. Think about it like this. One is going outward, the other is going inward, so it balances out. Okay? This pressure is always negative. During resting breathing, this pressure is always negative. However, it can be less negative or it could be more negative. Okay?
Yeah, in other words, it could be like a -1 sometimes, other
Or a
times
-5
-7.
sometimes, or
Right.
7.
Yeah.
Okay?
Okay.
Trans-airway pressure.
Also called transairway pressure is the difference between the barometric pressure and the alveolar pressure. The calculation is the barometric pressure minus the alveolar pressure. Is that what I read?
Hold on one second. It's also called trans-respiratory pressure, I think. That's what I meant to say. Let me grab the book, because it is in your book.
Page 87.
87. Oh, yeah.
Yes, trans-respiratory pressure. Some books call it trans-airway pressure, other books call it trans-respiratory pressure. So it's what? The pressure of what? Somebody. Atmospheric pressure minus what?
The alveolar pressure.
The alveolar pressure. Okay? And those pressure is important to understand later on for diseases. So that's why I'm giving you. Are you responsible to know those pressures for the exam? Yes. And you're responsible to know what is it exactly? And I'm not sure if I'll have calculation for you, but if they tell you the atmospheric pressure and they give you the alveolar pressure, you should know what the trans-respiratory pressure is. Right? Okay. Did you go through the calculation?
Is it the
Next page. Come on, calculation. Somebody. Yes, please.
Inspiration is 760 minus 757 units per millimeters of mercury.
Stop right there. Do we all agree that the atmospheric pressure is not going to change? It's going to be 760.
Right.
It's the pressure that inside the lung that will change and decides if air going to flow in or out. Right?
Yes.
Yes.
Okay. So when on inspiration, when air comes in, we said the atmospheric pressure is what?
760.
And then your alveolar pressure is going to be lower than your atmospheric pressure. So your trans-respiratory pressure will be what? Positive number or negative number? It's always going to be a positive number for air to flow in. Correct?
Yes.
Okay. Now on expiration, when you have your barometric pressure 760 and you need air to go out, the alveolar pressure is supposed to be what? Higher, right? So this respiratory pressure is going to be what? Negative on expiration, and it will always be negative on expiration. Make sense? Transpulmonary pressure.
The difference between the alveolar pressure and the pleural pressure. Calculations PTP equals pressure alveoli and pleural pressure minus pleural pressure.
Now we did say that what? Pleural pressure is always what? Negative. So this pressure on inspiration or on expiration, what is it going to be? Positive number. And that says 760 on inspiration. I doubt this is going to be 760 on inspiration because that's going to be what? The same as the barometric pressure. So will you have the gas flowing into your lungs? No. So it's going to be what? A little bit lower than 760. Right? So change it, put like 758.
What inspiration?
Yes, because
Wait, why are we changing that?
the alveolar, look at this. I said in here the alveolar pressure is 760. If your alveolar pressure is 760, then it's the same as what? Your barometric pressure. Are you going to have inspiration happening at this time?
No.
No. So it's supposed to be what?
Less.
A little bit less. Okay? Anybody that doesn't understand what I just said?
Okay, go back over that one more time.
If this is 760, which is what?
Because he's talking about this.
Are you going to have any inspiration
Because it
happening?
can't be
No.
the same as barometric pressure.
If this is 760 right
Right.
here, which is your alveolar pressure,
Right.
would inspiration happen?
Okay.
I'm
No,
asking.
no, no.
No, because it's the same as the mouth pressure. It's supposed to be lower, so gas is going to flow.
Oh, okay.
Got it?
Okay.
So it's going to be, I was just giving examples, okay?
So this would be.
Now on expiration, both of those are going to what? The pleural and the alveolar pressure are going to what? It's going to increase, right? So instead of 763, no, it's going to be 763, but see how it was 755 at the pleural pressure before? Now it's increased to 758. Okay? But it's always going to be what?
Below the atmosphere.
Below the atmospheric pressure. Any questions so far?
No, I think I'm a little confused again. Sorry.
You got a little bit confused. Okay.
Sorry.
No, that's okay. Do we all agree on this formula? Okay. On inspiration, this pressure is up. This pressure is always what? Below atmospheric pressure.
Right.
So it's going to be less than what?
760.
Or what? Or less than 0, let's say.
Yeah.
Right? Do you want me to go with the 0? Would it? I'm going to both ways. It's going to be either less than 760 or less than 0, right? This pressure is always negative. Okay? So if it's negative, it's going to be what again? Below 760. But it's going to be lower than the alveolar as well. So if this is, let's say, if we decide that this alveolar pressure is going to be 758, let's say, on inspiration. This is going to be 755 on inspiration.
That'll be less than the 758.
Got it? Now, let's go back to expiration. The alveolar pressure is going to be greater than 760 or greater than 0.
Okay.
Right? Okay. Now, this pleural pressure is always negative. right? So it's gonna be below what? 760. However, a little bit higher though this time. So instead of 755, it'll be 758. It's still negative, right?
Right.
Because it's still below 760, but it's less negative. Got it?
Okay.
Do you understand that?
Yeah.
Do I need to repeat this for anybody? Okay. Next.
Atmospheric, but is less negative during expiration compared with inspiration, 758 versus 759.
Okay. Transthoracic pressure. It's the difference between what?
Alveolar
Real pressure in the
Now
body.
you had another one that we talked about that says what? It's the atmospheric pressure minus the alveolar pressure. Which was what? Which pressure was that? Trans-respiratory pressure, or what we call it? Trans-airway pressure. Okay? So those pressures are kind of similar. Okay? There's one last pressure which is called transmural pressure, and that's the pressure of the airway that occurs within the airway or outside. So if you've got your airway like this, let's say, you've got pressure in here and pressure in here. That's all to it. So this is outside, this is inside. Okay? Do you guys understand what I just talked about? Do I need to go back?
Can you give us an example on the transpulmonary pressure? Like if you put it on the test or it's on a board, how will the question be asked? And you know how.
I have not made your question. However, it could be into calculation. I could ask, is it going to be positive or negative? Give me a definition of transpulmonary pressure. It's what?
Difference between alveoli pressure and pleural.
Right.
It's the alveolar minus the pleural, right? So it's PL, PALV minus pleural pressure. If I ask you, let's say, is this going to be a positive or negative pressure on inspiration? What you should know that on inspiration, this is going to be what? This pressure is going to be what?
Negative.
On inspiration. So it's going to get a value of what? 758, let's say. And you should know that this is always negative. Okay? So this is going to be like 755. Okay? So this minus this, it's going to give you what?
3.
It's going to give you a 3.
So you
Got
give
it?
us the pressures then?
I might give you the pressure, yes. I'm going to give you the pressure, but I don't know if I'm going to include it in your quiz, in your test, which I'm going to include it with. I don't know yet. But do you understand this concept?
Yes.
Or I might ask you, what do you think, which pressure is going to be lower on inspiration? I just want you to understand the concept itself.
So what you're saying is that pressure.
The pleural pressure is always
Always
negative,
negative.
period, on inspiration and expiration. However, on inspiration, when gas flows in, if it's 755, let's say, or minus 5, right? If we're given a baseline of 0, it's going to be 758 on expiration or negative 2. So it's not as negative on expiration. That's all I'm saying. Make sense?
Yeah, I mean, you already
Don't
you're gonna
overthink
get
it.
the number.
It's not that
Let's
hard,
just
trust
plug
me.
it in.
It's just
If you
plug it in. If
overthink
you know
it,
what
then you
these are.
just
Right.
you start getting lost.
Yeah.
Do you understand what I just explained in here?
Yeah.
Yeah.
That's all I want you to know. Do not overthink stuff.
I think we got it.
When we're
I
okay,
think
I hope. If you have questions, next time we can answer. And yes,
So basically, the transpulmonary pressure is gonna be given, possibly. And if that's
it's
given,
gonna what?
The transpulmonary pressure, if that's given, and I know that my alveolar pressure is gonna be 760. And then
It will never be 760 unless you're not breathing.
Okay.
You're holding your breath.
Okay.
Because this is going to be what? The same as what? The atmospheric pressure. And you're not going to have any gas flowing in or out.
So the gas is
Just
going
a
to
little
be
less.
raised.
I'm sorry, can you guys keep it down?
So if we're talking about gas flow, then I need to go back to my alveolar pressure, right? I'm trying to understand where you got, where you said 755.
I'm making up numbers.
Okay, okay.
I'm making up numbers. That's what I'm doing. So you know how we're creating pressure gradient.
Okay,
Okay?
okay.
So anything below 760 is called negative pressure?
Yes. Because 760 is what?
Atmospheric.
0. Anything below
Zero.
0 is negative. Anything above 0 is what?
Positive.
Positive.
Positive, right? Make sense?
Yes.
Yep.
Okay. Other questions? No. It's not that complicated. Don't overthink it. Just however I explained it to you. Okay? What is compliance? Anybody read the book and anybody can tell me what compliance is? Don't look at your handout. Put your handouts away. Compliance is the ability for your lung to accept a volume per unit pressure. So if I'm giving this unit of pressure, how much volume it accepts? Does that make sense? If I accept more volume, it's going to be what? More compliant or less compliant? More compliant. If I accept less pressure, it's going to be what?
Less.
Less compliant. Make sense? What's elasticity?
The ability of expansion. Alveolar, the alveolar.
That's it. And I'm looking for a rubber band. Anybody has a rubber band?
I do. Yeah.
Not mine, so you can throw it away. That's okay.
Look at this. It's the ability to stretch back once it has been what?
Stretch.
Stretch. Snaps back. That's what it is. Elastic recoil.
Okay.
Okay? Compliance is how much it would take per pressure that I'm giving it. So for the lungs, in a healthy lung, in a healthy individual, when the lung expands, it should have the ability to do what?
Go back.
Recoil
Go back.
back. If it doesn't do that, then what? There's a problem. And what makes the lung do that? The tissue that the lung is made of. That's what gives it the ability to kind of go back. The chest wall, on the other hand, does what?
Expand.
If you let it
Opens
go,
up.
it's going to expand. Together, those are what? Opposing forces, right?
Mhm.
One expands, the other what? Relaxes. Wake up right here. Wake up. One expands, the other one
Relax.
goes inward. Those two oppose each other, right? And now when you inhale and exhale, if I'm doing this, resting breathing, this is what this is called. When your lung goes back inward, it's not gonna collapse completely. It's gonna go to a volume called FRC. It will recoil back to something called FRC, which means, what does that mean? Let's say this is your lung, and I'm horrible in drawing. Whatever.
That's
This is
good.
your lung. This is your lung. If this is FRC, and you're breathing, you're gonna exhale all the way down in here, and you're not gonna exhale further than that.
Okay.
However, if I do this, am I going below FRC?
Yes.
Yes, because I'm exhaling more volume now. So you might be going as far as in here now.
Okay.
And that's below FRC. We will talk about those later on, next chapter, I guess, or the chapter after that. I included it for you so you have an idea of what I'm talking about. This volume that remains in the lung should always be there. No matter how much you try to exhale, there's this volume that still remains in your lungs no matter what. And this is called residual volume. Because if this volume does not exist, your lungs shut down.
They collapse, right?
That's
And
what
collapses. And this is called what?
keeps them inflated, right?
And this is called what? When your lungs are collapsed, what is it called?
Oh, surface.
Atelectasis.
Oh, atelectasis. Yep.
Right? Do we understand this?
Yes.
So during normal breathing, when you're breathing normally, your lungs go down as far as FRC because of the opposing forces of the chest wall and the lungs. Because one tends to expand, the other one tends to come back and inward and collapse. Those opposing forces, it makes it stop at FRC. Make sense?
Yes.
Okay. Let's go back to compliance a little bit. If I draw my compliance curve, let's say my compliance curve is like this. And I want you to look at page 92. And how do I plot this curve? If this is pressure and this is volume, for this unit of pressure, I got this much volume, right? And for this unit of pressure, I got this much volume. And this unit of pressure, I got this much volume. And then I connect the dots. Right? Okay. How am I going to explain this? Okay. Now, do you agree with me that at this part of the curve, right here, you're getting more volume because if you look at your alveoli, think about it like a balloon. When you start opening up the alveoli, you're going to get a lot of volume, right? Once the balloon is almost filled up with air, no matter how much you try to give it pressure, it's not going to expand more than this. It's going to what? Blow out, right? Do you agree? So, this part of the curve is at the end when the alveoli is what? Toward what now?
Maximum expansion.
Maximum expansion. This is when the alveoli is still a little and you have a lot of place for the volume to go in and the alveoli gets inflated. Does that make sense?
Yeah.
Okay. Can somebody read 93, the clinical connection for me?
In the clinical application section, case 2, page 139, a respiratory therapist is called to assist in the care of a 14-year-old girl with a long history of asthma.
Stop right there. So this girl has what? No talking, please. Do you have a question?
A long history of asthma.
No. Do you have a question? Okay. Long history of asthma. Did Miss Miller talk about asthma? Okay. What happens in asthma?
Constriction.
What happens to your, say that?
Bronchial constriction.
Bronchial constriction. So the problem is what? Inhaling or exhaling with asthma?
Inhaling.
Inhaling. Oh.
Is it exhaling?
It's exhaling.
Exhaling.
Because your airway are obstructed. You're able to get the air in, but you're not able to get the air out.
Well, doesn't that work both ways? No, I mean, if my bronchioles are constricted, I can't
It's
pull enough.
It's easier for you to get the air in. However, when you're exhaling, your airway just collapses completely like this, and you're not able to get the air out.
Because of the pressure difference?
Because of the pressure difference, yes. This is really important to understand because I was all the way through, I don't know what, and in my mind, yes, they have asthma, they can't breathe in. They can. They cannot, they have hard time exhaling. That's what they do. They have hard time exhaling, okay? Keep going.
This clinical event illustrates how an obstructive lung disorder, an acute asthma attack in this case, can quickly cause an acute decrease in the patient's lung compliance. During an asthmatic episode, the patient's bronchial airway obstruction progressively worsened, impeding the patient's ability to fully exhale.
Did you hear that?
Yeah.
Fully exhale. Did you ever see somebody with chronic lung disease where when they're trying to exhale, they do that? They're using their accessory muscles. They've got emphysema. Anybody is familiar with that disease? Smokers?
Is that why they get the barrel chest?
Yes. That's how they get the bill, and we'll get there. We'll get there.
It builds up their accessory muscles, doesn't it, by doing...
And not only that, they're using their accessory muscle to exhale, but when they're forcing it like this, what are they trying to do?
Trying to push out that CO2.
They're trying to create extra pressure that opens up their airway so they can get the air out. Do you get it? Do you understand what I'm saying?
Yeah.
It's called PEEP, and you will learn about that later on. They're trying to create positive pressure in their, where they're trying to open up their airway and let the air out because they have hard time exhaling. So, if you really think about that, somebody that has hard time exhaling, what's happening to their lungs now? Pretend this is my lung and don't laugh. Remember I said this is FRC. This is doing what? Resting, breathing.
Yes.
We breathe in and out, and you're going to exhale up to here, right? Now what's happening with somebody that's not able to exhale all the air? What's going to happen? If this is the volume that's remaining in your lungs, what's going to happen to this line? Is it going to go up or down?
Up.
It's going to go up. They're going to exhale up here now, right? Do you understand? They're going to exhale up here now. So if you look at their lungs is said to be hyperinflated. When they exhale, they cannot get all the air out. Now, because their lungs is hyperinflated, let's go back to this compliance curve. Now they're going to be breathing right here at the upper part of the compliance curve, right? Because what? Because now their alveoli, it's not where it's supposed to be. Volume in the alveoli, it's not where it's supposed to be at FRC, where they have the ability to put more volume in it, right? Because it's already above where it's supposed to be. So now they're going to be breathing on the upper part of the compliance curve. And this is horrible because you feel you're taking air in, but nothing is coming in. This is when you see they're air hungry. Do I need to repeat that?
So can that happen with asthmatics too during an asthmatic attack where they get that, extra full lung?
They get hyperinflated lungs because they don't have the ability to exhale the volume that they've been inhaling. So it keeps accumulating until it gets to their own. That's it. They feel there's no air is coming in. That's why when you give them a bronchodilator, which is beta what? Beta 2 agonist, you relaxes the airway, and now they're able to exhale out. Make sense?
Yeah.
Question?
So this is chronic. This condition happens over time, correct?
In an asthma, it's not chronic. It's something acute that happens. In emphysema, it becomes chronic. Because when you smoke, you destroy what? The elastic tissue of your lungs. And what does elasticity do? It tends to recoil your lungs to where it's supposed to be, at FRC, right?
So if your lungs can't contract, you're holding more of that air inside, so that it'll create this condition.
That's it. And this condition is chronic, and it's not reversible. In asthmatic, it is reversible. You give them a bronchodilator, it helps, right? In COPD emphysema patient, it's not going to help because they've destroyed the elastic tissues in their lungs. Do you understand this? That's all I'm lecturing about today. If you understand up to here, then you're fine.
Okay.
We'll build up next week.
Okay, so we have a test
Okay.
quiz on
Because I
Tuesday,
feel
right?
it's your right